Typhoid fever by Brittany Floyd Jimenez Guerrahan. Salmonella typhi was discovered by Carl Eberth in 1880 while examining a deceased patient of typhoid fever, finding the bacteria in the spleen and lymph nodes. While it was not discovered until the 1800s, many historians and scientists believe the first outbreak was around 430 BC when a plague of typhoid fever killed one-third of the people in Athens, Greece. It is also said to have been in the United States since the 1600s when an outbreak killed 6,000 people in Jamestown, Virginia between 1607 to 1624.
Salmonella typhi is the causative agent of typhoid fever. Typhoid fever is a life-threatening infection that affects the small intestines. It is also known as enteric fever. Morphology. Salmonella typhi is a bacillus-shaped bacterium, meaning it has a rod-like appearance. It typically grows individually or in pairs, and it is non-capsulated and non-spore forming. It belongs to the Enterobacteriaceae family. The bacterium thrives at an optimal temperature of 37 degrees Celsius, which is the normal temperature of the human body. It can grow in a wide pH range, from about 4.1 to 9.0, depending on the specific strain. S. typhi is aerobic, meaning it needs oxygen to grow, but it can also survive in low oxygen environments, making it a facilitative anaerobe. Lastly, it is gram-negative, which refers to how it stains during lab testing and helps identify its cell wall structure.
Pathogenicity. Once it has been ingested, it works its way into the small intestines, then the lymphatic system, and eventually throughout the body via the reticuloendothelial system, with the replication of the cells, which will eventually cause the symptoms. They will reside in the macrophages of the liver, spleen, and bone marrow of the host.
Symptoms. Once contracted, it can take between 7 to 14 days to begin showing symptoms. Based off data from the Mayo Clinic, a patient who is infected by S. typhi will experience high fever, mild to severe stomach pains, headaches, diarrhea, vomiting, and constipation in the early stages.
To diagnose typhoid fever, a fecal sample, blood sample, or bone marrow sample should be conducted. When running diagnostics, a fecal sample is only positive 30 to 40% of the time. A blood sample is positive 40 to 80% of the time, and a bone marrow sample is positive more than 90% of the time due to the bacteria residing in the macrophages of the bone marrow.
Treatment and prevention. Thankfully, over the years, scientists have found a treatment plan of different antibiotics that can be taken if infected. These antibiotics include chloramphenicol, ciprofloxacin, or ofloxacin, depending on the strand. It has also helped in the prevention of spreading the bacteria by having good hygiene habits and by health measures of clean water. Preventative measures include getting a vaccine before going to a place with poor drinking water and drinking from water out of a bottle.
The rate of incidence has gradually increased throughout the years of typhoid fever. Per 1 million total population in the African region in 2019 was only 1,365 reported cases, and in 2024 it had increased to 13,849 cases reported. In the Eastern Mediterranean region, per 1 million total population in 2019 was only 12 reported cases, and in 2024 it had increased to 45 cases reported. In the European region, per 1 million total population had stayed the same between 2019 and 2024 of only one reported case. In the region of the Americas, per 1 million total population in 2019 was at 4 reported cases, and in 2024 it had decreased to 2 incidences reported. In the Southeast Asia region, per 1 million total population in 2019 was 8 reported cases, and in 2024 it had increased dramatically to 527 reported cases. In the Western Pacific region, per 1 million total population in 2019 was only 5 reported cases, and in 2024 it had increased to 61 reported cases.
Patient prognosis. With treatment using antibiotics and preventative vaccines, the mortality rate is only 1 to 4%. Out of roughly 9 million people infected annually, only 110,000 people end up dying from the infection. Current research. Current research is trying to detect S. typhi in environmental samples for public health surveillance. It also focuses on using polymerase chain reaction, or PCR, to try and detect S. typhi in the blood. Future research. Future research is to use select antigens such as hemolysin E and sugars in the lipopolysaccharide to see the bacteria in the blood, and by using metabolic platforms to use biomarkers specific to typhoid to have a better diagnosis test.
We chose to research Salmonella typhi because of the story of Typhoid Mary. Typhoid Mary was the first known asymptomatic carrier of typhoid fever who unknowingly infected hundreds of people in the early 1900s. She was a chef all over the homes of New York and accidentally infected all of her employers. Due to the knowledge they had during that time, she was treated poorly and ended up going to live in solitary on an island to prevent the spread of infection to others.